AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, everyone, and welcome to our show, You and Your Doctor. And we are sponsored by All County Healthcare, Inc. We're live streaming on Facebook this evening. You can also pick us up on 1470 AM and 95.3 FM. We're also repeating this show on Tuesdays at 11 a.m. and 3 p.m. at 1470 a.m. and 95.3 FM. Thanks so much for joining us, folks. Oh, look, now we have light. Well, now we don't. Anyway, tonight joining me is going to be Dr. Jodi Schoernhaus Gold, and she is a DPM, Doctor of Podiatric. Is it Podiatric?
Yes, Doctor of Podiatric Medicine.
Podiatric Medicine, and she is wonderful. She helped me with my ankle once when I couldn't walk on it, and I've never forgotten, and I'm so grateful that she came on the show tonight. So, Dr. Schoernhaus Gold,
Hello.
Give us a little bit of spiel about you and what you do.
Well, thank you for having me. This is very exciting. What do I do? A little bit about me. Mm-hmm. So, I moved to Florida about 12 years ago after I had training in foot and ankle reconstruction. I went to Temple University and University of Michigan.
Yay for those Michigan fans.
After getting an inspiration from my family, I grew up in the field of podiatry, focusing on foot and ankle medicine, and it was always in my blood. So after I had that exposure, I moved to Florida and started practicing and really devised a unique boutique type of practice where my goal is to really educate my patients, get to know them, bring them in as family, and improve upon their health and wellness.
Awesome. I love that. And she has a marvelous bedside manner. Not only is she brilliant, but she's really someone that you can talk to, and she'll listen and really help you figure out what's going on. Tell us a little more about the inspiration. I'd like to hear where that came from and how it really got you going in this direction.
Sure. So I grew up in the field of medicine, really. My dad is a practicing foot and ankle surgeon in Philadelphia. It was really ingrained in me. And when you love medicine and find the human body to be the coolest entity out there, then
Agreed.
Really, it's very cool. Then you're attracted to it and you're drawn to it. So all courses growing up through middle school, high school, everything was science related. I am definitely a science geek and proud of it. And just, I would wake up and go to surgery with my dad in high school. He wouldn't let me scrub, but I always went to surgery with him and just learning from him. He is really regarded as one of the best in the profession. Wow. I would have stayed in Philadelphia, gone into practice with him, but frankly, I met my husband, who is also a podiatrist, and everyone will hear from him next. But we decided to come to Florida, and my family is now here, so we get that quality time with my dad still. And I opened up the Foot, Ankle, and Leg Vein Center in Boca Raton and Boynton Beach. You can see us on our website, Boca Raton Foot Care.
And what's
our
that phone number?
is 561-750-3033 or 3033.
Awesome.
Yeah, so we practice foot, ankle, and leg vein surgery in that boutique type practice.
Yes, your office is beautiful. And
Thank
you have really, really nice staff. That's something that's important. Great staff helps with a great doctor. So I want to ask you some questions, if that's okay.
Great. Let's get into it.
In your practice, you treat a lot of veins. Now, I know that there are differences, different types of veins on the body. There are spider veins and there's bulging varicose veins. Can you differentiate and maybe give us some body parts where these would occur and Does insurance cover any of this? I know it's a lot of questions, but if we can maybe go through that, that'd be great.
Of course. So the biggest thing is that anybody can look at their legs and be able to see on the surface what is going on. So if the veins are flat, blue, red, or purple, and are not raised from the surface, those are more considered spider veins or broken blood vessels on the surface. Those are considered cosmetic and can easily be treated with a treatment called sclerotherapy, which is using a chemical to damage the vessel, or by a laser. So those are considered cosmetic.
So which would be better and what part of the body? Let's say ankles, for instance, or I guess elsewhere people can have.
Of course, people can have spider veins anywhere, but they tend to form along the legs, the foot, and the ankle because we stand.
Right.
And that's where a lot of the pressure ensues. So with the vein network is a pressure system, so that's why it collects in the legs. Really, most people have it along the outside of the leg as well as along the foot and the ankle. The sclerotherapy is a better treatment than laser. And it tends to last about 5 to 7 years before you need a touch-up. Multiple sessions are required for treatment, maybe about 2 to 3, depending on how severe they are. And you have some bruising, then they look lighter and lighter and fade until you have about 75 to 80% improvement. Now, everybody reacts a little different, but with success, it's amazing. The treatment and the outcomes are amazing so that you can get healthy looking, sexy, pretty legs.
Yeah, it's especially important for women.
Yes, in Florida.
So we can wear dresses and shorts in Florida.
And bathing suits and feel good about ourselves.
Exactly.
You know, we want to feel good and sexy about ourselves.
Right.
When we talk about varicose veins, it changes into a medical condition. So varicose veins are when you have the blue, bulging, rope-like veins that stick out from the surface. You can have leg swelling, tired, achy, heaviness in the legs, also restless leg syndrome, which is the urge to move your legs at night, uncontrollable, as well as some cramping in the legs or itching. And that tells you that there's cramping, so you can develop night cramps.
Oh my goodness. You know something that just opens up a whole nother arena.
It does.
I did not know that.
And people don't also realize that those symptoms, the tired, achy, heaviness, leg cramps, itching, restless leg syndrome, can be caused by an underlying vein medical problem, which is a circulation issue.
Now, how do you discover that? Do they come into your office for a visit and you scan them? I mean, how is it discovered?
Exactly it. So people come in, and most people already see their legs. They have that appearance they've noticed, or they have these symptoms, the tired, aching, heaviness. They make the appointment. We do an initial consultation. Depending on the consult and what is found, I will scan their legs with an ultrasound. Now, I do all the ultrasound scanning myself because it is trying to describe a picture or visualizing a roadmap when you describe it to somebody else. It's not the same without seeing it yourself. So I try to do all the scanning myself, and I am certified to do so, which is a nice
awesome.
little
little perk.
Nice little perk. A nice little step on education.
Yes.
But after the scanning, we see where the underlying problem in circulation exists, or the backflow of blood. So essentially, veins take blood from a body part and bring it back to the heart.
Right.
Because the flow of the veins in the legs is opposing gravity, the flow wants to go towards the floor. So when you have bad veins, the flow of the blood goes towards your feet and the ankles instead of back to the heart.
So it pools.
It pools. And that's where you get the swelling, the bulging veins, etc.
Okay. So that can be very painful.
It can be.
Wow. So the bulging veins can not only have all these symptoms, but it can be just probably excruciating for some people. I mean, especially if they have to stand all day, 12 hours.
Exactly. If you're standing all day, if you're flying a lot, absolutely. You get a lot of tired, achy, heaviness. Some people find relief wearing compression stockings. Unfortunately,
do you recommend that?
I do. I think it's a great introductory treatment. However, it's not permanent. How often are we going to put on our compression in Florida? So
right.
hot.
It's too hot. Yeah, you sweat to death.
And unfortunately, there's no other form of conservative treatment besides elevation and rest. We can't keep our legs elevated all day.
Right. You can't. You have to work. You have to move around. That's very impractical.
Exactly.
But wow.
So now people seek treatment in the office. And the treatment in the office has been a tremendous advance in medicine because it has replaced vein stripping.
Ooh, I remember that. I remember when I was in pharmacy school, that was not good.
Pretty barbaric.
Yes.
Now everything is done in the office. You're awake, little downtime, and you resume your activities immediately. It is one of the greatest advances of our century, for sure.
That's pretty amazing. It really is. And you were talking about laser too. What laser is a little less effective than the sclerotherapy?
So that's for spider veins. When we talk about laser for spider veins, we're talking about a laser on the surface of the skin. And for that, the injections are slightly better. When we talk about treatment for bulging varicose veins and the underlying circulation, laser is better. So it's a little flip. Yes.
So it's a little different.
It's a little different.
Interesting. That's
Yes.
very interesting. We'll have to hear more about that. Thought we were going to take a break. Let's see. So, are any of these things? Are any of these treatments covered by insurance?
When you have the varicose veins or underlying circulation problem called venous insufficiency, that is covered by insurance.
Super. That's
Yes.
wonderful. Now, Medicare, regular insurances, pretty much everybody.
Pretty much everybody, we pretty much take it all. However, there are stipulations that you have to fulfill in order to get it covered. You have to have tried the compression stockings. You have to show that it's painful, interfering with your activities.
Okay.
To try to get it covered.
So, in other words, the insurance company requires that you fill out paperwork or the patient fills out paperwork, something along those lines?
Exactly. Upon coming into the office for the consultation, you'll fill out the paperwork, and that will enter into the conversation of being qualified by insurance.
That makes sense.
Most people are. If they're severe enough that they've made an appointment, typically it's covered.
It's usually pretty bad.
Mm-hmm.
Yeah, that makes good sense.
Yes.
And what can people do to prevent having these things? I mean, other than not working or not standing for prolonged periods of time, what can someone do? A listener or a viewer, if you're out there and, let's say you're 25 years old and golly, you don't want to have spider veins or varicose veins, what could they do?
Prevention, the best way to prevent is to wear compression stockings. So if you're on your feet a lot, if you're pregnant, if you have a job with prolonged standing, if you're a flight attendant and travel a lot, wear compression stockings, even if it's in knee high. Today they make comfortable ones. There's fashionable ones. You want to wear something. Something is better than nothing.
Right. And what about the ones toeless or with the toes? Are you opposed to one or the other? Is one better than the other?
I'm not opposed to any. Whatever is going to make you wear them more and longer, then you're comfortable with it, I'm fine with that. I do think the closed toe ones are a little uncomfortable, so I recommend toeless thigh highs.
Okay.
So they're open at the toe and only come to the thigh.
So how far up on the thigh? Just
Pretty
midway?
Pretty
Like
high
midway?
up. Pretty
oh, wow.
high up.
Okay.
Mhm.
All right. So you see that there's a decrease in having the varicosities if they wear them.
Absolutely. And start young. Heredity is the number one cause for poor circulation and vein problems. So having said that, look at your parents' legs and you can thank them for anything that's on there.
Mom and Dad, you're so good to me.
And post-pregnancy, so you can thank your children as well.
Yes, that does make a big difference.
Yes, it does.
That's definitely a noticeable time. So what are some of the advances that you were saying that there are advances other than the sclerotherapy, which obviously is the best? What about, I'm just really curious about the deep veins. If you're going to do laser on that, what does that look like for you? as the doctor? Like, how are you getting in there and
Exactly.
and
So
doing
this is where the advances have come in the past 5 years. So there's laser or radio frequency, and both treatments are performed in the office. You're there about an hour. Procedure time is about 20 minutes. Under the guidance of the ultrasound, we enter the vein with a needle. Through that needle, you put in a laser fiber. And a laser fiber is like a piece of glass,
Oh, okay.
a small piece of glass in the vessel. You have to numb up the leg along the course of the vein with a tiny needle, similar to getting a local anesthetic at the dentist.
Okay.
And then after you're numb, you turn on the laser or the radio frequency machine, and you take the fiber out of the leg. As it comes out, it closes off the vessel.
It shuts it down completely.
It does.
Really?
So it closes off the portion of the vein that is having the poor circulation.
Okay. Wow.
Yes.
Wow.
It's quite amazing.
That is amazing.
Where the advances have come now include a glue.
Okay. Glue.
There's a glue, and there is also a foam that is through a new technique in the line of the vein
Okay.
where you can inject foam along the course of the vein. The benefit of both of those is that you don't have to have the anesthetic, and it has decreased procedure time, so it's a faster procedure.
What about healing?
It has also improved healing to decrease some pain, discomfort, and swelling.
Okay.
Now, there's not a lot of pain post-laser. Nothing a Motrin can't handle.
Right.
However, it has even decreased it more. The only downside is those two procedures are not yet covered by insurance. They are
So the glue
FDA
and
approved.
So glue and foam not covered by
No,
insurance.
but they're great. If you don't have pain, you still have bulging varicose veins, you are afraid of needles and don't want the numbing medication, and you have some money that you can allocate toward the procedure, absolutely, it's been amazing for people in that who fit that category.
Wow, that's completely fantastic. And we were talking a little bit before the show, so I'm just going to dive right in. You were talking about some type of a pedicure, like a medical pedicure.
Yes.
So Dr. Schoernhaus Gold was talking about a medical pedicure, and I said, what is that? So I'm going to let you explain that to our listeners and viewers because I'm fascinated.
Of course. To expand the practice, we've included a medical-based pedicure or a medicure. It is a treatment of the skin and the nails where various conditions are treated. I have a certified, she's a certified medical pedicurist through high levels of training on sterility, foot and ankle conditions, as well as diagnosis and treatment. She is outstanding. It is the most thorough cleaning of your skin and your nails that anyone could ever receive with cosmetic touches. So she'll do a full polish and full treatment. She'll do anything for dry, cracked heels, nail fungus, nail deformities, corns and calluses, and that is all done as a specialty pedicure.
That's awesome.
It is.
What about diabetic patients with heel care and the bottom of their feet? I mean, are those kinds of things covered by insurance?
Well, that's a perfect candidate for a medical pedicure. Somebody who is high risk. We don't want to just go into any local salon and get a pedicure.
Right.
They're so full of
Bad idea.
bacteria,
Fungus,
fungus, etc. So we have a lot of people who don't want to enter that arena, who have poor circulation problems, rheumatoid arthritis or other rheumatoid conditions, diabetes, etc. And they come in and they have the medical pedicure, and it's a safe environment with a thorough cleaning that is needed.
Okay.
Other diabetic patients should certainly see myself or Dr. Gold for annual foot checks, making sure that they don't have any open wounds, deformities, or other things that can lead to problems that typically arise in a diabetic.
Okay, that's awesome. Now, for your diabetic patients, is there something that you guys have in the office, every 6 months they need to come in and you'll call them or schedule them so for their convenience so they don't forget? Because
Yes.
people forget.
Yes, people do forget. Typically, we like to see a diabetic every 3 months if there's loss of sensation called neuropathy or poor circulation.
Okay.
a healthy diabetic who doesn't have any skin conditions or lack of sensation or circulation problems, every 6 months is fine. The problem is diabetes really affects the feet.
Yes.
And if you ignore it as a diabetic, you will develop a problem. And some of the biggest problems is that in a diabetic, you actually don't feel your feet. So you may not even feel if you step on your insulin needle. You may not feel if you have a pebble in your shoe. And that is when the problems really ensue.
Right. Definitely can cause infections that get into the body and cause sepsis, which is a systemic infection or infection all over your blood.
Amputations. The number one risk of amputation is a diabetic patient who has loss of sensation in the feet called neuropathy.
Yeah, we want to avoid that at all costs,
Of course, limb salvage.
Yep.
We want to practice limb salvage.
Right. I think just the prevention and inspecting your feet or having someone else inspect your feet if you're diabetic is critical and crucial to having that great foot health.
And I think one thing that sets aside myself and Dr. Gold, we really spend a lot of time educating our patients. We both feel that educating our patients is the key to patient adherence or compliance to our recommendations. We also provide a lot of written handouts. A lot of patients forget what is told to them as soon as they leave
Agreed.
the room. Moreover, we're speaking a foreign language to these individuals. So how do patients understand what we say? We really try to provide educational materials and have them understand a treatment plan that is best for each specific patient.
Right. I think that's really critically important too, because I think you're right. They listen to what you're saying, but they're really not hearing you because they're so concerned about what's going on with me that then when they leave the office, they'll have these materials and can refer back to them and say, oh, I missed that. All right, so this is what I need to do.
Yes, especially when people are in pain. When you're in pain
True. You don't
and you're
think
emotional,
you're not
clear.
Yeah, you're not clear on what you're thinking or doing or what someone else is saying.
Saying, of
Moreover,
course.
are you guys available to do any sort of speaking engagements? Do you do seminars where people can learn more about how to take better care of their feet?
Of course, we do quite a few lecturing, quite a bit of lecturing. We teach residents. I can certainly provide information for any upcoming seminars that we have. But we do try to educate. Certainly our website is a plethora of information at BocaRatonFootCare.com. And on January 15th, we will be launching our new website. So that's very exciting as well.
Ooh.
And we will post that information on Facebook and other avenues as well.
And then how people can actually get in touch with you for any sort of speaking engagements or, even like the Women's Expo. I don't know if you've been to that.
They're great. We do health fairs and
Okay,
expos
great.
all the time. Of course, spreading education and understanding of various conditions that can affect people. It's the best way is to spread the word.
Absolutely. And, we can help do that since we've heard this, folks. Anybody that that may have issues with their feet or diabetic, et cetera, we can speak into their lives and just pay it forward. Just let them know that you care about them and that they need to take care of their feet. And Dr. Schoernhaus Gold, where can our viewers and listeners reach you again?
So you can find us at the Foot, Ankle, and Leg Vein Center with offices in Boca Raton and Boynton Beach. Our website is BocaRatonFootCare.com or BoyntonBeachFootCare.com. And our phone number is 561-750-3033. Otherwise, 561-750-3033.
And you want to give us that information one more time? Because I know when people are driving or they're listening and they're looking frantically for a pen and paper.
I will talk
that would be
forever
great.
about my life, my work, my practice.
I would love that.
Foot, Ankle, and Leg Vein Center in Boca Raton and Boynton Beach, BocaRatonFootCare.com, and BoyntonBeachFootCare.com, 561-750-3033, or 561-750-3033, however you can remember it.
Super. Is there something you'd like to leave the viewers and listeners with? Something like just from you that you would like to say to them, that you would love for them to hear from your heart?
Sure. It's a new year, 2017. Start to take care of yourself. We were just talking outside. We get so wrapped up in life, we forget about ourselves. We're trying to help our mothers, our children, our practice, everything. take time for yourself. If you do have a foot and ankle condition, leg veins, anything you're curious about, make the appointment and take time for yourself. We want you to walk with comfort and look great doing it.
Absolutely. I think that's so incredibly kind that you would come on the show and give us this information. I don't think that people seek this kind of thing out until something drastic happens. Like for me, when my foot was in such pain I couldn't walk, and my friend says, "You've got to go see Dr. Schoernhaus Gold. She'll take care of you." And I did. But it wasn't until that point that I sought you out. And I think that prevention is really the best way to do it.
It is key.
There's just no other way.
It is key.
If you do it, then you don't have to worry about having some sort of a problem and then doing it. And then they'll get to meet you, and they will enjoy you and your office staff, and then they'll keep all their appointments, which is awesome. And I want to thank All County Healthcare, Inc. tonight. They are the sponsor for our program, and that is, once again, All County Healthcare. You can find them at allcountyhealthcare.com. And we are live streaming tonight on Facebook. You can also see the repeat of this show on Tuesday at 11 a.m. and 3 p.m. And that would be on 1470 AM radio and 95.3 FM radio. Thank you so much for joining us tonight at You and Your Doctor. And we appreciate it. Thank you. And thank you, Dr. Schoernhaus Gold, for joining
us.
us. Thank you.
It's fun.
All right.
Thank you.
Bye-bye.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hey, good evening, and welcome to You and Your Doctor, the other half. And I am speaking to Dr. Jason Gold, who is a DPM, a doctor of pediatric medicine, and there's Dr. Gold. And I want to let you know our show tonight is sponsored by All County Healthcare, Inc. We are live streaming on Facebook right now, and we are also on FM 95.3 radio as well as 1470 AM. And thank you so much for joining us, folks. Dr. Gold, thanks so much for showing up tonight.
You're welcome.
I really
My
am
pleasure.
Very
Thanks
grateful.
for having me.
Very grateful. So please tell us a little bit about you, like your start and your education and anything you care to share like that.
Sure. I've been practicing currently now for 12 years. I can't believe it's already in double digits.
Wow.
I still love when patients say you don't even look like you're 30 yet. So,
True. That's true.
it-
I agree with that.
So, definitely.
Oh, here. I have to speak into the
Oh,
A
okay.
little closer. Here, just
All right.
just pull it. There we go. So that everybody can hear you.
Okay.
Perfect.
Great.
There we go.
As after the readjustment. So yes, I've been practicing now, currently 12 years in Florida. So I can't believe it's been this long. Seems like just yesterday I started, but it's been great. I trained up. I went at the Temple University School of Foot and Ankle, and
Just a little
also
closer. There we go.
went to University of Maryland. So
Okay.
and
Awesome.
then part of my training as far as
Chirps?
yes,
Yeah.
good. Fear the turtle. Fear the turtle.
turtle.
Yes. And then I did a 3-year surgical residency in South Jersey in foot and ankle surgery, with part being with a foot and ankle orthopod as well. So I got to see a lot of different variety from the podiatry world and the orthopedic world as well.
Wow.
So it was
That's
good.
quite the education.
Yes. It was a great fundamental and a great background to springboard me for my career.
Yeah, I would say
Definitely.
so. Definitely lots of surgery, and you
Probably did about 14 or 1,500 surgeries in training in the
In
3 years.
training?
Yes, in the 3 years in the foot and ankle.
In
So,
case you
lots.
didn't know, folks, that's a lot.
Yes.
That's
Yes,
many,
pediatrics and, encompassing all
so
ages.
what was the most common pediatric issue that you saw?
I would say flat foot.
Really, I would have never thought that.
Yes, pediatric flat foot was one of the most common ones. I also was part of a medical mission, and during those things, mission trips, it was mostly club feet was very common, and
I've heard.
equinus, so in the toe walkers, so all very, I guess, common things we see here.
So what do you do for toe walkers? I'm not familiar with that. That's why I'm
Depends the
asking.
age and depends the severity. A lot of times early on, you can talk about stretching exercises, accommodations, but after a certain period, you do have to talk about surgery for the patient. So to lengthen the Achilles or the tendon above the gastrocnemius
Okay.
muscle.
Okay. Calf muscle, right?
Yes.
Okay.
Oh, good.
You
Good.
better hope I know.
Uh-huh.
So you moved to Florida from
Okay.
up north.
I moved from
and-
Philadelphia. Been practicing now in, I would say, Boynton Beach for about 2 years. 10 years before I was in Delray Beach. So my wife and I finally joined forces after about 10 years, and we negotiated and agreed to, join forces. So it's been great, though, over the last couple of years. So
Yeah,
And-
that's incredible. Yes, I'm familiar with your wife because of my foot problem. I had to go
Okay.
see her for, and she helped me immensely.
great.
Yeah, I was
Great.
very, very happy.
left or right? Because we're splitting them up now.
Right.
Okay, good. So should still be right. So yes. All
You're splitting them up left and right? Are you
well, we gotta
serious?
no, just kidding. Just kidding. Really, just kidding. So,
Oh, goodness. So, you came down here, you have your offices. What are some of the advances in medicine in treating conditions of the foot? And you've suggested arthritis, sprains, and tendonitis.
one of the biggest things that even wasn't even as available 2 years ago or 3 years ago is the use of either PRP or amniotic stem cell shots. The latest, I've had
So
patients.
explain PRP for our listeners and viewers.
Okay.
They're not going to be familiar with that.
PRP is basically when patients have to have their own blood drawn, and they'll basically spin it down and use the platelets out of that blood, and they'll inject it back in. It's not a cortisone shot. It's actually a shot that can hopefully heal what's ever wrong, whether it's a torn tendon, a tendonitis, plantar fasciitis. We found that amniotic stem cells are even better just because they have cells that can divide even better than the PRP. And they've had some patients recently that have been on the verge of surgery and, for tendon tears, major ankle tendons.
Wow.
And you give them a shot, and basically within a month or two, they're better. So it's been pretty amazing, actually.
So after one shot, or is it a series? Is it sometimes a series of shots?
Depends. The severity. Most patients are one shot. Sometimes you do have to do 2 shots. So,
Okay.
but no, it's been unbelievable. My mom actually is a prime example too. She's my, let's say, poster child, but for many reasons. But but she was treated up north for close to 6 months in a boot and immobilization, physical therapy, and never got better. And she came down here, and I gave her 2 shots about 2 months apart, and she's 100% better for basically Achilles tendonitis and avoiding surgery. So, which is great. When you can avoid surgery for the patients. So then, especially everyone has such an active lifestyle in Florida, no one wants the downtime of surgery.
That's true. That's a huge advantage.
Yes.
Are any of these things covered by Medicare or regular insurance? I mean, does it depend on the situation?
Not yet. The only thing that's really kind of covered with the amniotic is we've even used recently, they have new skin grafts actually for the diabetic wounds. And it's been where before they just used to use artificial ones. Now they can use the amniotic stem cell ones. And it's been interesting. They actually decreased the patient's pain. I'm not sure why, what anti-inflammatory property they have in it, but they've really been able to decrease decrease the time it takes to heal wounds tremendously.
That's fascinating. Mm-hmm. Yeah, because usually it's a long process normally a long process for diabetics.
Yes.
Because they're usually very deep, or they let it go for so long before they even notice it, and then you've got a bit of a mess.
Unfortunately, yes. With diabetics and they don't have a great blood supply. They don't have a great immune system. They don't have just basically everything they need to fight off. And usually their diet is not great anyway.
And that doesn't help.
That doesn't help.
That's a big problem.
Yes. As you know, plus if the grafts have just plus the faster you can kind of cover it, the less chance you have for bone infection or osteomyelitis with them. So,
which is very serious. The bone infection, the osteomyelitis can be very, very, very detrimental. Can also be deadly.
Yes, yes, they can. Unfortunately,
without a doubt. But this is all fascinating. So patients with arthritis, sprains, tendonitis are all folks that are candidates for these types of therapy, and I that is amazing.
Yes,
and you get to be a part of this. This is like history being.
It is, but before
changed.
We would offer cortisone shots, as an alternative, and cortisone, yes, it might help the pain. Definitely, sometimes has some detrimental effects. Mm-hmm. The worst part about this is if it doesn't work. There's really no downside. It's not going to destroy the joint. It's not going to destroy the tendon and cause any additional tearing.
Right.
It's only going to help, or just not do much.
Or maybe it's someone who's resistant, and maybe they just need more of the therapy than, say, your 1 or 2 shots. What do you think of that? Is that possible?
To do like 3 shots?
Yeah.
Or sure. Honestly, it would depend how the patient's doing. Obviously, if there's no relief after 2 shots, I wouldn't keep on going down the same path.
Okay.
But if the patient's 60-70% better, sure, by all means, give them the 3rd shot to hopefully get them towards the 100%. But if there's no relief, then I don't think
just say don't discontinue.
To think more about the surgical options at that point.
Okay.
If it's not, or live with it, unfortunately.
Okay, and do you diagnose if a patient has arthritis, or do they come to you referred from another physician who's already figured that out?
Usually we diagnose it. Or the tendon tears, we would diagnose it. But we do get referred from lots of local physicians from the area as well.
Okay, yes.
For the different, fractures and Achilles ruptures and whatnot.
Do you see a lot of that?
Yes, definitely.
You see it in kids, sports?
Not necessarily as much the ankle sprains, more with the kids, the soccer players and things like that. Not as much the fractures because they're young.
Right.
And
they're resilient.
Yes.
They bounce.
Yes, they still have good bones, and they're not mature, like I like to say, like as we
are.
Yes. So they're a little more resilient, but they do have the sprains that we have to watch for the young athletes and the soccer players. And one thing about the sprains is everyone, not to say, we usually just think, oh, it's a sprain. Sometimes when it just keeps on coming out of place and you have constant pain of the ankle, those sprains can be fixed for these players, so you can tighten down the ligaments for them, where it's actually almost stronger than it was, obviously, even where it is now or even before. There's new advancements with that as well.
That's interesting.
Sure, you can almost use fiber wire or some of the skin grafts and make these ankles even stronger, like for the chronic sprainers, so they don't have this continued problem.
That's
anymore.
Interesting. I remember growing up, there were kids that they'd sprain their ankle at the drop of a hat.
Sure,
and
once it's
wonder
kind
why.
of sprained out, with a young athlete, and that's why they're the best candidates for it, because the ligament, it gets stretched out, and then it heals in a stretched position. So your ankle is very unstable, where it needs to be kind of a
Loose.
nice tight mortise per se, and hinge per se. So when it gets loose, it can't function the way it was. That's why it leads to clicking all the time, cracking, and chronic pain. So it is kind of, with the young athlete, good to sometimes fix the ligament, because the recovery is so quick, especially for the kids.
That's great. So what is fat cushion restoration, and why is that unique to your practice? This is going to be interesting. I like this.
I'm not sure. No, I'm just kidding. The fat cushion restoration is kind of something unique. We started doing it in the office probably about 10 years ago. Dr. Schoernhaus started, and it's been working out great, because it's also something else that's kind of saved surgery for people. It's not just for women that wear high heels. It's for any high pressure area that you have in the foot. So under the bottom of your second toe, or sometimes on the top of your fifth toe for women that have wear tight shoes. Anywhere where there's a corn or there's a callus, obviously looking at the proper x-rays and making sure, you can almost inject this filler called Radiesse into the area, and it basically cushions the region. I've had patients that have had calluses where they wanted to come in every couple weeks for you to take because of the pain, or have to go to the pedicures for that. You give them a shot. Sometimes it takes 1 or 2, because you wait a couple weeks in between to let it grow. But it's allowed women to have pain with wearing high heels. Or like I said, at the 5th Met, sometimes you get corns in between the 4th and 5th toes, where it really bothers patients. You just put a little bit of extra cushion basically right where you need it, and it's been amazing as far as avoiding surgery and patients just becoming pain-free, more importantly.
Wow. Does that get rid of the calluses?
It does.
Whoa, it gets rid of the calluses.
In some of the areas, it can really get rid of the calluses. It depends, obviously where it is and looking at the x-rays, but some areas it can actually get rid of the calluses. The other thing that we've done somewhat is after diabetics, the same thing, where they've healed some ulcerations. We've used it in them, where because there's high pressure areas, we've put the cushion right underneath it after they've closed, and it gives them a little added cushion, so that it will hopefully prevent future ulceration or future breakdown in that region. It's basically giving them a little added pads per se right underneath their skin, so to hopefully avoid the future breakdown with them, which is kind of neat.
That's very cool. Now, what about how long does that last for a diabetic?
It depends on the pressure it gets. It could be 1 up to 2 years.
Wow, that's a long time.
Yes.
That would be really helpful and avoid foot problems for our diabetic listeners and viewers.
Yes, and for some of them, yes. Obviously, you have to look at the foot and evaluate, but some of it's got rid of their ulcerations for long periods of time after healing it.
That's incredible. Yeah, our lighting on and off.
No problem. Okay. Just wondering if I was having...
You're fine. That is really incredible, and I did not know that you were using the Radiesse for that. That's incredible. So what do you do with hammer toe or the curvature, the outgrowth of the bone structure on the side of the toe? I mean, is there anything like this that you could do for that? Or is that something that's really a structural, we've got to
It's kind of structural, but if you can kind of sometimes... There's different things you can do for different conditions, but sometimes, like I said, if it's the 5th toe, you can just give them a little extra cushion. If it's just the top of the 2nd toe where they're having their pain, sometimes you can still, like I said, give them a little of the Radiesse, the cushioning right where they need it, and it won't be as much irritated as for them. So besides that, it's just the wider shoes or eventually get the surgery. Sometimes we can release some tendons in the office, which also would help some patients out. But it's really patient dependent on that.
And how severe, I guess.
How severe, exactly.
Yeah, what they present with.
Exactly.
Okay, and so a lot of people suffer from flat foot. what are some of the problems associated with having flat feet, and what can you do about that?
Flat feet.
And how do you know? How does someone know? I mean, unless they come in and see you.
Sure. Looking down, not to say after coming out of a pool, obviously they see a full pattern and they won't have any area for their arch. Usually the inside portion of their foot is coming in and rolling in. The big thing is when they would come in to see you is when they had pain. That's when people usually start to come in.
Where do they have pain, though?
It depends. I had a 11-year-old girl come in this morning with a pretty bad flat foot, and she was starting to get bunion pain, which is of her big toe joint. She wasn't kind of mild ankle pain. So, it really depends what age it really starts bothering them when patients start to pay attention. But the sooner you can get them into some better shoes, supportive shoes, an insert or an orthotic for their feet, and help getting the deforming forces on them, usually flat feet respond to conservative care and they don't end up needing surgery most of the time, which is what's nice is that we always use the analogy like eyeglasses. You can put an orthotic in and it'll help them and the patients will do well. Sort of like your eyeglasses, you can see, but they're not going to recreate the arch for you where like eyeglasses sort of don't fix your vision per se.
Right.
But orthotics will get rid of the pain most of the time for flat feet.
And do you prescribe the orthotics? Do you send them to someone who makes the orthotics?
Usually, we depends on the severity. We do have an over-the-counter in the office, which sometimes we use, but patients with the real flat foot do need a custom orthotic where we would cast their foot in what's known as the neutral position, so we can kind of also tilt the heel and kind of what's known more of a varus to get some of the biomechanical forces out of the flat foot. That's when it'd be more important to do a custom orthotic, which we would make in our office.
Okay, so you could do that in your office.
Yes,
then. Awesome.
Sure.
So they would be able to go see you. You would determine if they have flat feet and whether they needed that custom orthotic or not.
Yes, exactly.
So
after an evaluation.
Yes. That's fantastic. One-stop shop for Dr. Jason Gold. So tell me, what do you see very frequently with surgeries that you need to perform? Like, what is a very common thing that you see down here in Florida?
We see a lot of ankle fractures, believe it or not.
Older patients, young patients? Like, what's your age range?
All ages. I've done them from 14, 16 is probably the youngest, up until just recently a 95-year-old lady. Not that happens very often.
Wow.
Yes. Yes, she was living by herself, just even up until she fell, which was great, But yes, no, all ages of ankle. We also see bunions are very common.
Okay. And so is that a complicated surgery? Now, obviously, ankle surgery can be very complicated. Depends on what's snapped.
I like to say it's a long recovery bunion surgery. It's not painful as painful as everyone has kind of made it out to years in the past where they had the horrible pain.
Oh yes.
It's truthfully it's not that bad anymore. It's about a day or two of pain, but it is a good 2-month recovery for patients.
2 months for bunions.
It does take a while because to get
Why does it take so long?
Because the knee is like a really big joint per se. So when they put a prosthetic in, goes over a big area. For a bunion, you have to break the bone, shift it over, wait for the bone to heal, which is a good 6 weeks, 8 weeks. So right there, you're just waiting almost 6 weeks for the bone to heal. And then it's got to get used to the new 85% of your weight goes through your big toe. That's not a big area to get used to all the different mechanics where your knee can transmit those forces or the hip over the much bigger area. So it just takes a little while for the bunion to, they get there, but just you have to make sure your patient's aware it does take a good 2 months or so to get better.
Wow, so they're not going to be walking on it
for
2 months?
No, most of them can walk day one. I'm just talking about, going back before they can, I say about before going to the gym is close to 10 weeks, things like that.
Okay.
You can walk on it the first day. But before going back to in Florida, it's going back to tennis courts. It's 10 weeks.
Exactly.
That's about 10 weeks. That type of thing. But most of them you can walk on them the first day. Pain tolerance wise.
Wow, that I did not know that. That's pretty amazing. But that is a really long time. What about What about different types of issues with the tarsals?
The metatarsals?
Yes, the metatarsals.
Um,
Like if one gets fractured,
we see a
do
ton.
you do anything with that? Or
Depends the severity of the fracture. If you have what's known as a displacement, which is a separation of your fracture fragments, then you would have to fix the fracture. Most fractures usually don't require surgery, but sometimes they do. One of the toughest spots for a fracture to heal is actually the base of the fifth metatarsal. It's what's known as a Jones fracture because it has one of the poorest blood supplies in the foot. So those you really try to handle, with kid gloves per se, and not have the patient do a lot of walking because you don't want to, because it has poor blood supply, plus the tendon of the brevis pulls on it a lot. So it's known to have healing difficulties.
ooh, so do they have to be cast for that? Do you put them
Usually,
in a cast or no?
I do removable
Boot?
walking boots these days.
Okay.
Don't usually do a ton of cast unless the patient's kind of a non-compliant patient, sort of.
There are a few of those out there.
Yes, I mean, but they make the cam walkers so great these days where they can kind of still wash and, if they're trustworthy and they offer just as much protection as a cast. So, and patients love them much better
Cool.
than cast.
Cool. I like that. So tell our viewers and listeners something authentic about you and your work. Something that you love or that challenges you, something
I would
that
say
you care to share.
I would say that my favorite thing is surgery. Taking especially, surgery of patients that were referred to me from other doctors that might have had a surgery that wasn't performed well or come out great, that you can take someone that was in, a year or so of pain and make them better. And that's very rewarding, that you can be the hero in some ways like that. And truthfully, I just had a longtime patient that he came back and he had a bad infection and I was able to save his leg basically for him. Where
That's
all the other
incredible.
doctors were basically recommending removing it, and he came back to me, and I was able to save it. He's 99% closed now, so.
That is incredible.
And he would actually probably be watching this on Facebook Live. So
Love it.
I won't
Love
mention
it.
names because we
I
can't
won't.
actually.
We can't do that. I know that.
But he knows what I'm talking about.
He'll know.
So,
That's
yes.
really, that is
Yes.
truly incredible. It is the best feeling when
Yes,
you help
when you
someone.
can someone help save
When everyone
their
else-
legs.
When everyone else gives up and tells you no, I would have to say, don't always believe what you hear.
Yes, there is sometimes hope. There's, you can pull things out and save it, and I've been able to do that a bunch of times with our patients, and
Great
that is
job.
probably the most rewarding.
Great job. I
Thanks.
love hearing that. It's incredible. So tell us
Saving
again.
saving the world one foot at a time.
That's right.
Yeah,
I like it. So look at our camera here and
Okay.
tell us your location, your phone number, your website, all that good stuff.
Sounds good. My location is West Boyan and East Boca. Phone number is 561-750-3033. And it's Boca Raton Foot Care. And once again, I'm Dr. Jason Gold, certified in foot and ankle surgery. So
Thank you, Dr.
Thank
Gold,
you.
for showing up and,
Appreciate the
and
time.
just giving us all this information. We really
great. Thank
appreciate
you.
it.
I really appreciate it.
Absolutely. And you have been watching You and Your Doctor. And my name is Faith Washington. It is sponsored by All County Healthcare, Inc. You can find us at allcountyhealthcare.com. And we are live streaming on Facebook tonight. You can catch a repeat of the show at 1470 AM and 95.3 FM on Tuesdays at 11 a.m. and 3 p.m. Once again, thank you so much for watching and listening, folks. And thank you again, Dr. Gold.
Thank you for having me again. Appreciate
Have a
it.
great night. Bye-bye.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its host, guests,